part 2 because I had to go grab my charger. But I'll try to talk faster because I could talk forever and ever about everything on here, but this has already been long, so I'll try to be faster. Okay, types of clogged follicles. So we have comedo, or comedones for plural. These are non-inflamed. So we have, remember, we have inflammatory acne, that's the papules and pustules, and then non-inflamed acne are comedones, and those are your buildup of cells, sebum, and other debris inside the follicles. So we have open and closed comedones. An open comedone is a blackhead. That's just the proper term for blackheads. It is open at the surface and exposed to air. The reason it's actually appearing black is because when that sebum is exposed to air, it oxidizes and it changes the color. Just like for anyone who knows how hair coloring works, if when you initially mix the color, it looks one way. If you leave it sit for a while, it changes color. That's the same thing that's happening, and it's only at the surface. So if you were to ever extract a blackhead, you'll notice the surface tip of it is black, but then inside where it's not exposed to air, it's white again. Closed comedones, those form when the openings of the follicles are blocked with debris and white cells. So it's basically the same thing, except the opening of your follicle is closed, and whiteheads are extremely hard to extract. And then there's sebaceous filaments. Those are small solidified impactions of oil without cell matter. They block the follicle and can cause acne breakout. They're often found on the nose. Milia, so this is not acne right here. Milia is a category of its own. Milia are small epidermal cysts that appear as firm white papules. They are whitish, pearl-like masses of sebum and dead cells under the skin. They have no visible opening. A lot of times they are mistaken for whiteheads, and they're the most common in dry skin because they are a buildup of pretty much crystallized dead skin cells. They're also seen in newborns shortly after birth sometimes. And so a lot of times milia are found around the eyes. They do look similar to whiteheads. You kind of have to have experience seeing both to decipher what is what, but the only way to get them out, you can't extract them with a comedone extractor or with your fingers like you would an acne lesion. They have to be removed with a lancet, and the rules on that varies state by state, but in Virginia, unfortunately, as estheticians, we can't use lancets. It's not in our scope of practice. So, unfortunately, dermatologists have to get them out, even though we easily could, but we're not allowed to. So, yeah, treatment for milia. See, now that's not to say that you can't get them on some good products that could help soften that up, help the process along. So increasing exfoliation and using a retinol product or a retinoid, so a vitamin A derivative of any sort. And using extraction oil to make a tiny opening, yeah, we can't do that, like I said, because that would be a lancet. Causes of clogged follicles. Pilosebaceous unit. So the pilosebaceous unit is the entire follicle, including the hair shaft, sebaceous gland, and the sebaceous duct or canal to the surface. The hairless follicle with attached sebaceous glands is the main follicle involved in acne. So basically the same pore where your hair grows out, that is where your sebaceous glands are connected to the base of that. Some factors that cause clogged follicles are excess oil. Oh my gosh, they used the term that I said. Look at that. I was just saying that on the fly. And look at that. They do say it. I'm proud of them because usually I feel like they don't mention things that are super important. Retention hyperkeratosis, sebaceous filaments, or just the opening, which is technically called the ostium, of the follicle is too small to let impactions out. Oops. I want to move the picture. I want to move the slide. Let's see. Retention hyperkeratosis. Oh, look at that. They even give you a handy-dandy definition. So let's see how my summary matches up to what they actually say. So, it is the Hereditary, oh, I did say genetic, yes. The hereditary tendency for acne-prone skin to retain dead cells in the follicle, forming an obstruction that clogs follicles and exacerbates inflammatory acne lesions such as papules and pustules. Yes. Sebaceous hyperplasia. These are benign lesions frequently seen in oilier areas of the face. They are often white, yellow, or flesh-colored. Cryotherapy, that is done by a dermatologist. Cryo is anything cold, so that is when a dermatologist freezes something off. Surgery or laser excision are recommended treatment options. So sebaceous hyperplasias, that is not acne. That's not something we can extract. That's why it says different treatment options, as in they would have to be referred to a dermatologist. What these look like are, they're skin colored, but they're donut shaped. So they are it's an indentation with lifted borders, and there's a kind of like a divot in the center. Going on Google Images and typing it should bring up some good photos as examples. But what it is it's actually it is a sebaceous gland disorder caused by sun damage. And I feel like most often you see these on the forehead. Now, not that I've seen them often, but when I do, it's generally on the forehead. And then seborrhea, this is a severe oiliness of the skin, an abnormal secretion of the sebaceous glands. When it's in the scalp, it's called dandruff or seborrheic dermatitis, but it can occur around the eyebrows, behind the ears, and around the nose or other areas of the face. A side note, it is not acne. Grades of acne. So we go by grades 1 through 4 just to kind of help communicate what severity of acne somebody has. Acne is graded on a scale of 1 to 4. Grade 1 is mild, and grade 4 may require medical intervention. Grade 1 is minor breakouts, mostly open comedones, some closed comedones, and a few papules. So in other words, they most likely have blackheads, whiteheads, and maybe a few inflammatory lesions like papules. Grade 2 would have many closed comedones, more open comedones, and occasional papules and pustules. Grade 3 is red and inflamed with many papules and pustules. A lot of times you see this with teens, so that's typical teenage acne. And then grade 4 is cystic acne. They may also, though, have comedones, papules, pustules, and inflammation. Scar formation from tissue damage here is common. So when skin is really aggravated and damaged by an acne lesion, what it does is it produces an overproduction of collagen to try to hurry and repair the skin, and that in turn causes a scar. You can also get, it doesn't mention this, but with severe acne, or especially if somebody has picked at it and they shouldn't have, you can get post-inflammatory hyperpigmentation. So that is when a dark mark is left behind. Has anyone ever had a pimple and then it turns into a dark mark? So that is post-inflammatory hyperpigmentation. So the reason that happens is because your melanocytes, which produce your melanin, those are actually part of the immune function, and they try to protect the skin. So when they're sensing inflammation, they send melanin to try to protect, and that's why you get post-inflammatory hyperpigmentation. You can also call it PIH for short. So in the lighter Fitzpatricks, so like 1 and 2, a lot of times the hyperpigmentation won't be brown, but instead it'll be pink or red. That is your pheomelanin. And then for the other Fitzpatricks, 3 through 6, it's usually brown or very dark brown, and that is eumelanin, or true melanin. All right, acne triggers, genetics, hormones, and environment. So, let's see. If acne is a family disorder, your client's acne will be influenced by that DNA programming. Curing acne will not be possible. That is so important. There is no cure for acne. If somebody is genetically predisposed, all you can do is treat. But you can help get the acne under control. Addressing the skin holistically will improve the skin. So if you have somebody who is genetically predisposed to acne, that is really a lifelong process of keeping up on their product usage. It takes a lot of discipline. Hormones can be a factor too. The androgen, so androgens are the male hormones. Now, women have androgens as well, but just not as many. The androgen fluctuations during puberty, monthly menstrual cycle, pregnancy, and perimenopause contribute to oil production changes that can bring on comedones, papules, and pustules that usually evidence themselves periodically. So increased androgens spikes up your oil production, and that can cause clogging of pores. Treatment would be additional exfoliation to keep the stratum corneum thin so oil can escape to the surface more easily. So if you have surface dryness, a really rough texture on the surface of the skin, all those dead skin cells are in the way and the oil can't flow up and out of the follicle. If it's getting trapped in there, that causes a problem. Environment is important too. So working in an environment with poor air quality, pollutants, or comedogenic exposure can increase the inflammatory response of the sebaceous glands. Dramatic climate changes also influence oil production. Lifestyle also has an effect. Stress can stimulate the adrenal gland to produce more hormones, which leads to more oil production. Pressure or friction from cell phones, hats, scarves, and any devices or object that touches the face can also transfer bacteria. Fragrances from dryer sheets, laundry detergents, or shampoos can cause sensitivity and a breakout too. A lot of times, I will ask somebody, first of all, how often they're washing their pillowcase, because you generally want to do it once or twice a week, if not more. Secondly, I'll ask if they have acne, what laundry detergent they're using. And I will suggest that they try switching to Free and Clear, whatever brand that may be. It could be Tide or All. But just a Free and Clear that doesn't have colors or scents added to it, because sometimes that could be a trigger. Cosmetics and skincare products as well. Comedogenic ingredients can block follicles, which cause cell buildup, resulting in comedones. You also are going to want to, now this is a tedious task. I don't always do it. I do it for my clients because remember I'm a makeup artist, but not for myself. But it's really important, honestly, to wash your makeup brushes after every single use. I know that is a much easier said than done. I don't always do it for myself, but that is what you're supposed to do. Medicated treatment options for acne. Common medications, adapalene. So if you've ever seen Differin in the store, Differin gel, the active ingredient is adapalene. It is a topical peeling agent similar to retinoic acid, but maybe less irritating than tretinoin. Potential side effects are drying, redness, irritation, and photosensitivity. So let me back up because I feel like they're not explaining things very well. So, retinoic acid, in case we haven't talked about this yet, is a retinoid. Okay, so retinoid is that is the category of all vitamin A derivatives. They're all called retinoids. Retinol is just one of them. So retinol is what you hear most commonly. That's what you see in stores because it is over the counter. It is weak enough to be sold in like Target or CVS. But then you have varying strengths and different branches. So pure retinoic acid is the strongest form of vitamin A, so the strongest of the retinoids, and that is what is prescribed by dermatologists. It's a very strong peeling agent, so that's why it can't be given over the counter, because you don't want somebody not using it correctly. You want someone using it under supervision of the dermatologist because it's so strong. Tretinoin is just a brand name of a retinoic acid, if that makes sense. There's also other retinoids too. There is retinaldehyde. There's retinol palmitate, which is a really weak one. There's a bunch of them. So common side effects are definitely drying, redness, irritation, photosensitivity, aka sensitivity to the light or the sun. So always want to be wearing sunscreen, but especially if somebody is on one of these topical peeling products. There's also azelaic acid. This is a topical aesthetic agent that flushes out follicles. Pretty much the same side effects here. Birth control pills. Obviously, an oral medication used to regulate the androgen hormones that impact oil production. So if somebody has really hormonal breakouts, sometimes they'll be put on a estrogen dominant birth control pill, because that helps bring the estrogen levels back up, and then the androgens aren't so prevalent. And then clindamycin, that's a topical antibiotic that kills bacteria. Very drying though. Isotretinoin. You might be saying, what is that? Isotretinoin is Accutane. You notice it has tretinoin in there, and we just talked about tretinoin. That is because isotretinoin, or Accutane, which is the brand name, it is the oral version of topical tretinoin. So it's oral vitamin A. So isotretinoin is an oral controlled medication used for severe acne. It requires close medical monitoring, including lab work, to check liver function due to its toxicity. It's used as a last resort for severe acne. Potential side effects are severe dryness, birth defects. So literally, I was listening to a skincare podcast just the other day talking about how serious it is when somebody's on Accutane or isotretinoin in general, because of the risk of birth defects. You literally have to take, like, I think it's weekly pregnancy tests, and you have to be on at least 2 forms of birth control, because the doctor prescribing it is not going to take any risk that you get pregnant and the baby has a birth defect. So I think what they said was, I know they said the baby could be missing ears, missing eyes, just all kinds of terrible things. Okay. And then there's, also, if somebody is on isotretinoin, aka Accutane, that is not a long-term solution. They would be on it for maybe 6 months, and then generally get off of it and start a really good skincare routine. You wouldn't want to be on Accutane for too long. I think liver damage is an issue that could be caused, and then also your skin is kind of having those negative side effects for a very long time, even after you've gotten off of it. So, for example, you can't get a wax on your face for a whole year after stopping Accutane. That's how long it's still affecting you. Spironolactone is an oral medication used to regulate the androgen hormones that impact oil production as well. There's Tazarotene, or Tazorac is the brand name. That is another retinoid, so topical. And tretinoin, that is Retin-A. aka pure retinoic acid. Let's see. All right. Just trying to summarize here because I know I talk so much. All right, polycystic ovarian syndrome, or PCOS. It's a hormonal condition that affects 1 in 20 women during their childbearing years. Symptoms include increased androgen production that causes the development of cysts on the ovaries. So sometimes we can see increased hormonal acne, abnormal hair growth on the face, arms, thighs, neck, and breasts. All right, vascular disorders. So these type of vascular lesions may be considered tertiary lesions. Rosacea is an inflammatory and vascular disorder with multiple causes that are not completely understood. This is true. It's still not very well understood, but it's very much a genetic thing. It's a progressive disorder starting with flushing and increasing redness. Rhinophyma, a thickening of the skin, can occur. So this is generally, there are 4 different stages of, subtypes of rosacea. Rhinophyma, that is the 3rd stage, and it is thickening of the skin on the nose. You will usually see this on men, so it is much more common for women to have rosacea than men, but when men have it, it is generally more severe. So there's the first stage is just kind of like normal rosacea, nothing crazy. The second one is pustular rosacea, which is where they have pustules on the rosacea areas on their face. 3 is rhinophyma, and then 4 is ocular rosacea, because you can actually have rosacea in your eyes, which really grosses me out. So what we are seeing are these distended or broken capillaries. Those are within the rosacea, and those are called telangiectasias. Those are the proper name for it. Pigment disorders. So many of those too. So, dyschromia is just the general term for any abnormal pigmentation in either direction. Hyperpigmentation is an overproduction of pigment, and then hypopigmentation is a lack of pigment. Sun exposure is a cause, of course. Certain drugs as well can be a cause. So hyperpigmentation, a bunch of different kinds. There's melasma. This is also known as pregnancy mass, because a lot of women have it when they're pregnant, but you don't have to be pregnant to get it. But it is very much hormonal. It usually is around the mouth area. This is incredibly hard to treat as an esthetician. It doesn't mean that we can't get it to budge slightly, but really they would need more more aggressive treatments than what we could offer them to really make a difference with the melasma. Sorry. Lentigos. These are from the sun, so this is a perfect example right here. That's just a fancy word for sunspots. The technical name is lentigo. And then your freckles are technically called ephthalates. And a nevus is a birthmark. There's also vascular nevuses, and a port wine stain is one of them. All right. Poikiloderma of Cavate, a skin condition caused by actinic bronzing from chronic sun exposure. The skin turns a reddish-brown hue with a distinct white patch under the chin. I've never seen this before, and plus that would be out of our scope, but I've personally never seen it. We talked about this before. Post-inflammatory hyperpigmentation, PIH, darkening pigmentation due to an injury to the skin, or the residual healing after an acne lesion has resolved. It could be deep red, purple, or brown in appearance. And then a tan results from exposure to the sun. It is visible skin and cell damage. There is no such thing as a healthy tan. As the moment your skin has changed colors, it's already damaged. Hypopigmentation is just the opposite, so it is the absence of pigment resulting in light or white splotches. Much less common than hyperpigmentation disorders. Now, hypopigmentation, there's definitely nothing we can do. Hyper, we can. Hypo, we really can't replace that pigment. Even dermatologists, they're only just kind of coming up with ways to replace pigment. So, at the moment, really nothing too promising for that. All right, a few different kinds. So, leukoderma is loss of pigmentation, and vitiligo and albinism are examples. Now, albinism is the person has no melanin in the whole body. Vitiligo is those white patches, and this is an example of that. All right, dermatitis is really just a general term for any type of skin irritation. And there's two different kinds. So contact dermatitis is contact with allergens that cause and caustic chemicals. Can also cause skin sensitivities or disorders. Allergies and skin eruptions are common. Allergic contact dermatitis is caused by exposure to and direct skin contact with an allergen. Atopic dermatitis is chronic, and it's a relapsing form of dermatitis. Atopic means excessive inflammation from allergies. The redness, itching, and dehydration of dermatitis makes the condition worse. Use of humidifiers and lotion can help. Now, eczema is an inflammatory, painful, itching disease of the skin. It can be acute or chronic in nature. And then irritant contact dermatitis. The degree of irritation will vary depending on the individual. Symptoms range from redness, swelling, scaling, and itching to serious, painful chemical burns. Perioral dermatitis, that just means around the mouth. Peri means around, oral means mouth, so perioral dermatitis is around the mouth. Seborrheic dermatitis is a form of eczema characterized by inflammation, dry or oily scaling, and crusting and or itchiness. There is status dermatitis caused by poor circulation. All right. We are nearing the end. Okay, types of hypertrophies. A hypertrophy is an abnormal growth. Many are benign or harmless. However, some growths are premalignant or malignant, which can be dangerous or cancerous. The term hypertrophic is used to describe thickening of a tissue. The opposite of hypertrophy is atrophy, meaning wasting away or thinning. And types can be hyperkeratosis, which is what we talked about earlier, a keratoma, which is a callus, or a keratosis, which is just an abnormally thick buildup of skin cells. So types of hypertrophies, keratosis pilaris, this is a big one that you will most likely be asked about on a test. It's usually called chicken skin, and it's generally on the backs of people's arms. It's just those bumps. A mole is also a type of hypertrophy, psoriasis as well, and skin tags. I'm just going to kind of roll through, hit some important ones, and then we will be done. All right, so we're just going to hit mental health conditions real quick, and then we will sum up. All right, dermatillomania is a form of obsessive compulsive disorder in which the person picks at their skin to the point of injury, infection, or scarring. Treatment includes cognitive behavioral therapy, hypnosis, and medication. Body dysmorphic disorder is a psychological disorder in which the client has a preoccupation with their appearance. All right, let's see. Conditions. All right, 3 more slides. Common skin conditions. Folliculitis. This is when the hair grows under the surface instead of growing up and out of the follicle. It's also known as an ingrown hair. Pseudofolliculitis. So pseudo means kind of like fake or like an imposter. It's also known as razor bumps. It resembles folliculitis but without pus or infection. Pruritus is the medical term for itching, and steatoma is a sebaceous cyst or subcutaneous tumor filled with sebum, also known as a wen. Sudoriferous gland disorder. So if we remember, sudoriferous glands are your sweat glands. We have 5 of them right here. Anhidrosis. So an is kind of like opposite anti. Hydrosis is sweating. So put it together, anhidrosis is a deficiency in perspiration. Bromhidrosis is foul-smelling perspiration. And my co-worker, teacher, Mimi, has a good way of remembering this. She said it starts with bro, and she says your brother stinks. So I thought that was funny. Hyperhidrosis, hyper always means excessive, so that is excess sweat. And then diaphoresis is excessive perspiration due to an underlying medical condition. Menopause is an example. And finally, malaria rubra, also known as prickly heat, is an acute inflammatory disorder of the sweat glands, and it results in the eruption of red vesicles and burning, itching skin from excessive heat exposure. Okay, I know that was a lot. If you're still listening to this point, I am impressed. Email me and yeah, tell me what you thought. Thank you for listening, and as always, reach out with any questions. Thank you guys.